The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, please don't forget to like the video and subscribe to the channel for support. Belonging to a class of drugs known as statins, Ezallor Sprinkle is offered as 40 mg capsules. The active ingredient of Ezallor Sprinkle is rosuvastatin. What is Ezallor Sprinkle? What does it do? Ezallor Sprinkle is used along with a proper diet to help lower bad cholesterol and fats such as LDL, triglycerides, and raise good cholesterol in the blood. It works by reducing the amount of cholesterol made by the liver, lowering bad cholesterol and triglycerides, and raising good cholesterol decreases the risk of heart disease and helps to prevent strokes and heart attacks. How to use Ezallor Sprinkle? Take this medication by mouth with or without food as directed by your doctor, usually once daily. If you are taking the capsule form of this medication, swallow the capsules whole. Do not crush or chew the capsules. If you have trouble swallowing the capsules, read and follow the manufacturer's instructions for use leaflet. You may carefully open the capsule and sprinkle the contents on 1 teaspoonful of soft food. Swallow all of the mixture without chewing. Discard the mixture within 60 minutes. Do not prepare a supply in advance. The dosage is based on your medical condition, response to treatment, age, race, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. If you are of Asian descent, your doctor may direct you to start with a lower dose because you may be more sensitive to its effects. Antacids containing aluminum or magnesium can reduce the absorption of this drug. If taking this type of antacid, take it at least 2 hours after this medication. Take this medication regularly in order to get the most benefit from it. Remember to take it at the same time each day. Keep taking this medication even if you feel well. Most people with high cholesterol or triglycerides do not feel sick. It is very important to continue to follow your doctor's advice about diet and exercise. It may take up to 4 weeks before you get the full benefit of this drug. Here are some things to know before using Ezallor Sprinkle. Before taking rosuvastatin, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of liver disease, kidney disease, alcohol use. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Limit alcoholic beverages. Daily use of alcohol may increase your risk for liver problems, especially when combined with rosuvastatin. Ask your doctor or pharmacist for more information. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Discuss the risks and benefits with your doctor. This medication passes into breast milk. Because of the possible risk to the infant, breastfeeding while using this drug is not recommended. Consult your doctor before breastfeeding. What are side effects of Ezallor Sprinkle? Common side effects of Ezallor Sprinkle may include headache, weakness, muscle aches, or nausea, stomach pain. A very small number of people taking rosuvastatin may have mild memory problems or confusion. If these rare effects occur, talk to your doctor. Rarely, statins may cause or worsen diabetes. Talk to your doctor about the benefits and risks. If this video worked for you, subscribe to the channel to like, support, and comments. Share your views and experiences in the comments section. I wish you healthy days.